Let's review all 12 cranial nerves, their functions, their functional categories, and potential problems that may happen if a lesion occurs on the nerve. The first cranial nerve is the olfactory nerve. This nerve's function is smell, and this nerve is visceral afferent. Potential problems to the olfactory nerve can cause anosmia, which is loss of smell.
Can you hold one nostril closed and smell it? What do you smell?
The second cranial nerve is the optic nerve. The optic nerve's function is vision, and this nerve is somatic afferent. Potential problems to the optic nerve may cause anopsia.
What color is this?
Blue.
Okay. Can you cover your other eye? What color is this?
I don't see anything.
Can you read this eye chart for me?
J, K, 12, K.
Can you tell me how many fingers I'm holding up?
2,
Go now.
12,
How about now?
7. When are we going to start, doctor?
Starting now.
I can't see anything.
You can't see anything in
No.
any area.
Nothing.
Okay.
The third cranial nerve is the oculomotor nerve. This nerve's function is for eye movements and pupil constriction. This nerve is somatic efferent and visceral efferent. Potential problems to this nerve could cause lateral strabismus when the eye deviates inferiorly and laterally, ptosis, causing the eyelid to droop, and mydriasis, when the pupil dilates and pupillary light reflex is lost.
Alright. Shine this light in your eye. Okay, and then do the other eye. Alright.
The fourth cranial nerve is the trochlear nerve. The trochlear nerve's function is eye movements. This nerve is somatic efferent, and potential problems to this nerve could cause the eye to deviate superiorly and laterally.
So I want you to just use your eyes to look in all different directions, okay?
The fifth cranial nerve is the trigeminal nerve. This nerve is divided into 3 subsections. Cranial nerve 5-1 is the ophthalmic nerve, and this nerve is sensory afferent, and it is the tactile and pain for the forehead. Cranial nerve 5-2 is the maxillary nerve, and this nerve is sensory afferent, and it includes the tactile and pain for mid-face. And the cranial nerve 5-3 is the mandibular nerve, and this is sensory efferent and afferent. It innervates muscles of mastification and has the tactile and pain for the lower face.
Slightly open your mouth. I'm going to do your other one.
The next nerve is cranial nerve 6, and this is the abducens nerve. The abducens nerve function is eye movements. It's somatic efferent, and potential problems to this nerve could cause medial strabismus, and this makes the eye deviate medially.
I want you to watch the stripes go by.
Okay.
Cranial nerve 7 is the facial nerve. The facial nerve's function is muscles of facial expression. It also includes taste, lacrimation, and salivation. This nerve is somatic efferent, somatic afferent, and visceral afferent. Potential problems to this nerve could cause facial nerve palsy or Bell's palsy, ageusia, and hyperacusia.
Do you taste anything? Smile for me. Can you puff out your cheeks? Can you raise your eyebrows? Can you clench them really hard?
Cranial nerve 8 is the vestibulocochlear nerve, and this nerve's function has both functions of the vestibule and the cochlea. This nerve is somatic afferent, and potential problems could cause ipsilateral deafness and a loss of equilibrium.
All right, can you hear this? Okay, I'm just going to pour some of this into your ear. How do you feel?
Dizzy.
Cranial nerve 9 is the glossopharyngeal nerve, and the glossopharyngeal function is for taste and salivation. This nerve has all functional categories. It's somatic efferent, somatic afferent, visceral efferent, visceral afferent, and potential problems for this nerve could cause ipsilateral loss of taste from posterior 1/3 of the tongue and sensory limb loss of gag reflex.
Do you taste anything?
The 10th cranial nerve is the vagus nerve, and the vagus nerve's function is parasympathetic for heart, lungs, and digestive tract, as well as involved in swallowing and your voice box, including the pharynx and larynx. It's somatic efferent, somatic afferent, visceral efferent, and visceral afferent. Potential problems to this cranial nerve could have caused the uvula to deviate contralaterally, loss of gag reflex, weakened hoarse voice because of weakness in muscles related to the larynx and pharynx. The 11th cranial nerve is the accessory nerve, and this nerve's function is for motor function of the trapezius and the sternocleidomastoid. This is a somatic efferent nerve, and potential problems to this nerve could cause difficulty shrugging your ipsilateral shoulder, as well as difficulty turning your head in the contralateral direction.
Gently turn your head to each side. Okay, now can you rotate your head down? How about the other way? Okay.
The last nerve, the 12th cranial nerve, is the hypoglossal nerve. And the hypoglossal function is that it innervates tongue muscles that later help in speech production, and this nerve is somatic efferent, and potential problems to this nerve could cause the tongue to deviate ipsilaterally when protruded, as well as dysarthria, which is slurred speech.
Can you say Fuzzy Wuzzy was a bear?
Fuzzy Wuzzy was a bear.
Martha, a 75-year-old Caucasian woman, has hypertension and has also reported high levels of stress because of personal issues related to her 2 children moving to another state. She is having trouble with dizziness when getting up abruptly and has difficulty swallowing, specifically when trying to push food to the back of her throat. The patient also exhibited shortness of breath when doing household chores.
Ms. Martha, please come into the doctor's waiting room and she will be right in.
Hi, Ms. Martha. My name is Dr. Krause and this is Nurse Garcia. She'll be helping me out today. What seems to be the issue?
Does it sound normal? There does seem like something is wrong there. What can it be, doctor?
I'm not sure yet, but we should run some tests.
Okay.
First, repeat after me. The cat sat on the table.
The cat sat on the table. Could this be dysarthria, doctor?
I think so. It is also known as slurred speech, and this is most likely linked to the 12th cranial nerve, which is called the hypoglossal nerve. But let's check something else to be sure. Please stick your tongue out.
Interesting. Her tongue is deviating ipsilaterally.
Am I going to die? I knew it!
Patience, always so dramatic. Relax. Let's run a couple more tests.
Okay.
Alright, could you run in place for 5 seconds? I would need you to stand up, please.
Sure.
Alright, now I'd like you to run in place for 5 seconds. Are you always this out of breath when you exercise?
No, before this problem, I was running marathon.
Could it be dyspnea?
Yes, I believe so. It is also known as shortness of breath. Well, I'm certain now that you have an issue with your hypoglossal nerve, which causes deviated tongue, shortness of breath, and slurred speech.
What now?
Well, there's not much I can do for you, but I can refer you to a local neurologist.
We should be able to help you out with more treatment options.
Okay.
Thank you for your time.